Hello friends, this is Sonu, and today we'll continue the general anesthesia that we half of the discuss already we discussed in the last video, and today we'll complete the rest of the topic. So in the last we discussed the main definitions, main feature, and the main stages that were important, and we discussed already the classification and pharmacokinetic, both the intravenous and inhalational anesthesia. Today we'll discuss the main mechanism of the action, the main drug property, because in different drug have different feature, and we'll discuss the indication and contraindication and also side effects. So let's start the first mechanism of the action. What is the main mechanism of the action? Actually, the main mechanism of the action is still not clear, that what is the main mechanism of action. But according to the physiological function of the brain, the scientists and the researcher all they thought, they think that it's act like that. So we'll discuss how it's act and what is the main mechanism. According to the some theory, they said that it's act on the reticular formation, that is our maintain the sleep, maintain the consciousness, and it also act on the hippocampus, that is the provide our short-term memory and long-term memory, and they said that also act on the cortex, thalamus. But according to the recent theory, they said that it's act on the receptor, and it's antagonist of the our neurotransmitter. So they said that it act on a ligand ion gated channel. Ligate gated ion channel. What is the ligate gated ion channel? It is the channel of the transmembrane. It is the group of the transmembrane which open and allow the ions inside, such as sodium, potassium, calcium, and chlorine. So it's the drug act on by this channel, and it's become antagonist of the neurotransmitter. How? We'll discuss. In the brain, some neurotransmitter have inhibitory and some neurotransmitter have excitatory. Inhibitory and excitatory. Usually, mainly inhibitory neuron have gamma aminobutyric acid, and for the excitatory have glutamate. We have more also, but the general anesthesia act just in a GABA and a glutamate. So, like most probably drug, like inhalational as well as intravenous drug, act on the GABA, but some of the drug will act on the glutamate. So which drug act on the GABA and which drug act on the glutamate? But before we discuss the main mechanism. So actually the drug act on the GABA A receptor. And it's open the chlorine, like it's a help to the penetrate the chlorine inside the neuron, and by this receptor it bind to this receptor and influx the chlorine inside the neuron, and neuron become hyperpolarized. Neuron become hyperpolarized. Neuron can't be stimulated whenever the drug act on a GABA receptor. And as we know that it's an inhibitory neuron, it means what? Whenever the main neuron become hyperpolarized, means what? It's it can't be stimulated. So the amount of the GABA become high and the brain function become diminished or brain function become inhibit. So mostly all I mean inhalational general anesthetic drug and as well as the intravenous anesthetic drug act on the GABA, but some of the drugs act on the glutamate. How? Glutamate, as we know, it is an excitatory neuron. So in these conditions, it should be antagonized. This drug is antagonized. It means it inhibit the glutamate and brain will not excited. So brain become more inhibit because it's a help to excitation. So drug will inhibit the glutamate and brain become again inhibit. Like nitric oxide, that is the gaseous inhalational, N2O. It is the gaseous inhalational. And the dissociative anesthesia, that is ketamine. The two drug, first the inhalational general anesthesia and second is the intravenous general anesthesia, which is slow acting, not fast acting. This is dissociative anesthesia. So these two drugs act on the glutamate. Actually, it's act on a NMDA. This is the N-methyl D-aspartase, a full form of the N-methyl D-aspartase. This is the actually the glutamate. So it act on the NMDA and inhibit this receptor by this two drug, and then glutamate become decrease. The amount of the glutamate in the brain is decreased, and the brain excitation become automatically will decrease, and brain become inhibit. And also some of the inhalational drug also act on this receptor. Most probably they act on the GABA. So actually the researcher and the scientists, they thought from the physiological function, because as we know that our main physiological function is the of the brain, how it's a depressed and how it's a work. Like GABA is an inhibitory neuron, glutamate is an excitatory neuron. So whenever the brain too much excited, the amount of GABA become automatically increase, and then brain become normal by the compensate. And whenever amount of the GABA become too much increase, it means what? Brain become too much inhibit. On the time glutamate will the amount of the glutamate will increase, and then it will be normalized. So it's both the neurotransmitter will normalize the brain. So from there they thought that general anesthesia will be work in the two receptor, and then become its will be depressed. So like that they thought, but it's still not clear what is the actually main mechanism. But this is the, according to theory, this is the main mechanism. So we discuss the main mechanism of the general anesthesia. Now we'll discuss what is the main property of the drug and what should be need in during the anesthesia. Before the start, we should know first analgesia, unconsciousness, and muscles relax. Muscles relax. Actually, the three things should be seen in the patients, because analgesia, unconsciousness, and muscle relaxation. If three features will not there, surgeon can't do surgery. They will not start surgery, because for the surgery, I'm not talking about the normal surgery. I'm talking about in a major surgery, like each surgery take time more than 30 minutes or 1 hour, 2 hours. For that surgery, analgesia should be there, unconsciousness should be there, and muscle relaxation as well as. So the three feature of the general anesthesia should be there. But some of the drug have, like for example, the nitric oxide. Nitric oxide have good analgesic property, but it says almost very poor amount of unconsciousness and muscles relaxation. You can say the even in negligible amount of. So that's why we discuss the which drug have what properties. But these three properties you should know that should be there in any patient where you giving the general anesthesia. So let's make like a chart type. First we discuss the inhalational, then we'll discuss the intravenous. It should be analgesic. Shortcut you can understand. Here it should be sleep condition like unconsciousness, and here will be muscles become relaxed. Muscles should be in a relaxed position. So for example, first drug is a nitric oxide. NO is formula is N2O. Nitric oxide. And nitric oxide very good analgesic property, but it's very poor sleep property, like anesthetic properties, and muscle relaxation is very poor. But it's a very good potent. You can see the potent analgesic property. Second, it's a gaseous. Second, a volatile liquid. That is the first drug is ether. Ether is a very popular drug, and you can say that this drug have the all feature. It's a good analgesic, good anesthetic, and good muscles relaxant. But due to some bad properties, we are not using nowadays. Due to some bad properties. What is the main bad properties? We will discuss later. Next one is the halothane. Halothane have very poor analgesic. You can say the very negligible amount of analgesic, but it's a good anesthetic properties, good unconsciousness. Muscle relaxants very weak, very weak. Next one is the isoflurane. Isoflurane. The same thing. It's a very poor analgesic, but anesthetic is good, and also the very weak muscle relaxant. Next we have desflurane. The same thing here, poor analgesic, good anesthetic property. Anesthetic means the hypnotic, like sleepiness, unconsciousness, and the muscle relaxation also very weak. And the last one, sevoflurane. The same thing here also, poor analgesic, good anesthetic, and very weak muscle relaxant. So this is the main, you can say the main feature of the drug that very important to know. And one thing also, that always will not give any anesthetic, general anesthetic drug alone. Most probably always give it the combination, because the main reason is that we need three feature for the general anesthesia. It should be analgesic, that patient can't feel pain during the surgery. Patient should be in a sleep condition, and patient muscles become relaxed. So for the three properties, we should add the different types of drug, because one drug don't have all properties. Just ether have all properties, but due to some bad characteristics, bad feature, we are not use this drug. For example, nitric oxide have good analgesic, but it's a bad uh, anesthetic condition, like it's a bad on unconsciousness and muscle selection. But we need three feature, so we give with halothane, but halothane have poor analgesic, no problem, because N2 we are giving with combination with nitric oxide, so nitric oxide have good analgesic, so analgesic will be from there. Next, it's a good sleep unconscious property, means anesthetic components, it's good to have anesthetic compound, but nitric oxide are poor, no problem, they will compensate from there. It's a very weak muscle relaxant, and the nitric oxide also have very weak muscle relaxant. But some another drug have good muscle relaxant. We'll discuss in a intravenous anesthetic drug. So like three drug or in some of two drug is depend upon the situation, is depend upon the patient's condition, and is depend upon the operations, which types of operation will we do. So on that time is will combine the drug. So just you have to remember that always we use in a combination. We will not use alone. Most rarely. Now we'll discuss the intravenous, and then we'll discuss individually drug. So from the intravenous general anesthesia, first drug is thiopentol sodium. Thiopentol sodium. The thiopentol sodium have very poor analgesic. Poor analgesic, but it's a good anesthetic property, means consciousness, good consciousness. The muscle relaxant, you can say very poor. Next one is the propofol. The same thing, it's also poor analgesic, good anesthetic properties, and very weak muscle relaxant. Next have methohexitone. Methohexitone sodium. There they also poor, good anesthetic properties, and the same here, very weak. Next one, etomidate. Etomidate, the same thing, poor, good, and the same weak analgesic. Next, a benzodiazepine group like diazepam, midazolam, and lorazepam. So the derivative of the benzodiazepam. Benzodiazepam. Here also poor analgesic, good anesthetic, and there is a moderate muscle relaxant. But it depends on the patient condition. In some patients have very poor, in some patients have moderate. And the ketamine next. Ketamine have good analgesic, but the sleepiness is the also can say not good and also not bad. We can say moderate. Very lightly, we can say very lightly. And muscle relaxation the poor, not good. Poor. And the last one is the fentanyl. This is the opioid analgesic. They also, because it's analgesic, so the name it's also good analgesia. The sleep is weak. We can say very weak. and the muscle relaxation and say moderate. So this is our inhalation anesthetic property, that in some of the drug have good analgesic, some of the drug have good anesthetic properties, and some of drug have muscle relaxation good properties. So that's why always with combination, we will give the always with combination. We will not give alone any drug, any anesthetic drug, always with combination. So this is the main feature of the drug that you need to know. And now we'll discuss the individually drug, because some of the drug have some good feature and as well as some bad feature. Let's start from the nitric oxide. Nitric oxide. So what is the nitric oxide? Actually, the nitric oxide usually saying laughing gas. Laughing gas. It's a colorless gas, and it's a non-irritating, no any smell, and non-inflammable anesthetic gas. And as I said that it's a very good analgesic properties, but it's very bad and you can say very weak the anesthetic properties and muscle relaxation. That's why use always in a combination by the halothane, because halothane have good anesthetic properties, by the isoflurane, desflurane, and some intravenous anesthetic drug. It's depend upon the situation and depend upon the surgery and depend on the time that what should be give on the, to the patient. So it's as I said, it's a colorless, non-irritating, no any smell, and non-inflammable. But some properties, some main properties that's important to know about the nitric N2. We always give nitric oxide with oxygen. It's always with nitric oxide with oxygen. Why? What is the main reason to give the O2? Like if we not give O2 with combination of the NO2, then patient will suffering from diffuse hypoxia. If absent the O2, the patient will be diffuse hypoxia. How will suffer diffuse hypoxia? See. For example, this is our lungs. Just for understanding purpose, it's not anatomical diagram. This is our lungs. Blood vessels. And this is our CNS. So like by the special mask or like by the cylinder, always the nitric oxide cylinder in a blue color. So by the pipe mask, the special mask will be put on the in the mouth area, and the oxygen cylinder becomes start, and it will go. So and as I know that the N2 is the very less soluble in the blood. Even in 1% it's soluble, and 99% will insolubility. So it means the insoluble gases are very fast go in our CNS. So whenever N2 will come in a blood and it go in a CNS very fast, because due to insolubility. So because it's a gaseous form, so the pressure become whatever pressure inside the cylinder, the same pressure will generate in a blood due to the insolubility. That's why it's very highly go in a CNS. And it's not metabolized by the liver and by the kidney, because it's a gaseous form, so by diffuse it go out without any metabolizing in the liver and kidney. But during the discontinuation, like after 10 minutes operation will be finished, but before the 10 minutes, like after 10 minutes operation will be finished, so before the 10 minutes the 100% of the oxygen will give the same pipe, like in the different cylinder you will like oxygen cylinder, and by the oxygen cylinder it connect the same pipe and will give the oxygen therapy. 100% of the 100% of oxygen will give. Why? Because like whenever the discontinue and whenever remove the mask, so it's a gaseous, it's not soluble in the blood, so whatever pressure, whatever the amount of the nitric oxide go in the CNS, the whatever pressure, the same pressure it will be diffuse out, the same pressure it will diffuse out. And before the diffusing, whatever amount of the oxygen is there, they will, as well as the nitric oxide and as well as the oxygen, it will go out. So during that condition, or during that time, the oxygen will absent in the area, in the alveoli, and that's why the patient suffering from diffuse hypoxia, due to the pressure, too much pressure will come, and it will be pushed out of the oxygen outside, and by the exhalation the nitric oxide as well as oxygen, the both will be exhaled, and here the oxygen become insufficiency. Due to this reason the patient will suffer diffuse hypoxia. That's why the oxygen will add before the end of the surgery, and to prevent the diffuse hypoxia. So that is the main property that we should know, that why add the oxygen, what is the main reason. This is the main reason, to prevent the hypoxia. That's why always combination with O2. And don't confuse with that it's combination with O2, so just it's act the all types of anesthesia, and nitric oxide plus O2 first, and then we'll add different types of drug like Halothane, Isoflurane, and some intravenous anesthetic drug. But NO2 will always give with oxygen. So we discuss N2O. It's mainly used in like all general anesthetic drug will use in a mainly minor surgery, but in some cases we'll use in different types of indications also, different types of disease, but mainly in a surgery, during the major surgery, and mostly in a major surgery. Now we'll discuss the Halothane. What is the Halothane? Halothane is just opposite of nitric oxide. Halothane. Nitric oxide have good analgesic properties, but bad anesthetic and bad muscle relaxant. But Halothane have bad analgesic properties, but it's a good anesthetic property. Like it's well unconscious, and the muscles paralyzed the same. Like it's weak muscle paralyzed. So it has good anesthetic properties. Anesthetic. It's bad analgesic. And one is more bad thing here, that during the Halothane, whenever you are injecting the Halothane, giving the Halothane, on the time it's contract the muscles. It should be relaxed, but on those conditions it's contract. So due to contraction, it generates the malignant hyperthermia. Hyperthermia means what? They increase the body temperature. it means, and how will increase the body temperature? The contraction of the muscles. So it's due to the contraction, it's generate the malignant hyperthermia. Hyperthermia, because it's due to the contraction muscles, it stimulates the our thermoregulatory center in a hypothalamus in a brain, and that's why the temperature become increased. So to the prevent the malignant hyperthermia, the one drug that is named dendroline, we should give on the time, and dendroline will prevent the malignant hyperthermia. Actually, dendroline will be the decrease the calcium influx from the sacroplasmic reticulum, and then muscles become relaxed and decrease the malignant hyperthermia. What is the dendroline? We discuss in a later whenever we discuss the muscles relaxing drug. But now you should know that which drug will be to prevent the which drug should be give for the prevent the malignant hypothermia. And due to the hypothermia, the patients have chill and severing due to the hypothermia because the temperature become high. So chill and severing. So for the prevent the chill and severing, the drug name is pethidine for prevent of this drug and prevent of this symptom. We should give dendroline for the malignant hypothermia and the pethidine and chill for and severing. So it's usually give by the nitric oxide with combination, and the for the indication as I said that it's used in always for the all types of minor surgery, but for the children it's a very useful drug and very safe. You can say the most popular drug for the child. Like the manually removal of the placenta during the childbirth, this drug is useful. And this drug also, like all anesthetic drug, most probably all anesthetic drug, all gender anesthetic drug is little bit always is depend upon the different drug. Have in some drug have more effect on a cardiac output, in some drug have very little effect, but mostly effect on the cardiac output and respiration. So here you should know that all general anesthetic drug is act on a heart and respiratory system. So in any cases you can see that decrease the blood pressure in every drug. Most like isoflurane is not act on a heart, but little bit they also act, and respiration. So all anesthetic drug is act on a heart and respiration, and it will be interrupt in the function of the heart and respiration. So as the halothane also it's interrupt the heart and respiratory center. So due to this reason you can see that if the cardiac output will be reduced, it means what? That urine become reduced because it's depend on the urine is depend upon the cardiac output. So urine become reduced, and the respiratory center. So in some time you can say hyperventilation will be in some rare cases some patients, and bradycardia, sometime arrhythmia, sometime hypotension due to the cardiac function become little bit effect. So these are the common effect in every general anesthetic drug, not in the halothane native oxide, even every drug. So in halothane one indication you can in manually removal placenta in childbirth. During the childbirth we can use this drug. Now we'll discuss the ether. What is the ether and why nowadays ether is not using? What is the main bad thing of the ether? Ether. Actually, ether is we can say it's a good general anesthesia because it's a the three properties. It has an analgesic property, it has general anesthetic properties, and as well as the muscle relaxant also. So that's why it's a very good analgesic. But due to inflammation, it generates the inflammation. It's a very irritating. And it's explosive also. Due to this three bad thing, and this three bad thing is very bad in a patient or any person who is taking the ether. That's why now it is not used due to this reason. But in some country, in some hospitals, still are using, and it's also not too much expensive. Due to this reason, still are using. But according to the modern anesthetic drug, we are not we are not use the ether. So ether, as I said, that it's an inflammation, irritating, and explosive. But it's a very good analgesic property. It's a good, very like anesthetic properties and muscle relaxant. And also they use in all types of surgery. But we'll not discuss about the ether because it's not used nowadays according to the modern anesthetic drug. But the little bit information you should know. And the some drug also, like for example isoflurane. Now I'm going to discuss isoflurane, desflurane, and sevoflurane. That these three drugs are also we can say it's latest generation of the ether. The different change of the structure, but is the latest generation of the ether. So, and it's a very modern drug and most widely used in all over the world. These three drugs, it's inhalational categories. So isoflurane, desflurane, and sevoflurane. The three are almost similar, but in like the desflurane is more potent than isoflurane. Sevoflurane is between the isoflurane and desflurane the potency, but almost the feature and mechanism and the indication the most probably are the same. So that's why we'll discuss. First, it's a non-inflammable. It's good anesthetic drug. It's produce potent anesthesia, but it's poor analgesia and weak muscle relaxation. But always use with combination with nitric oxide or with halothane. But halothane we can't use because halothane have also not good analgesia. Mostly with like nitric oxide or in a intravenous anesthesia like by the with the ketamine, because ketamine have good analgesic. So like always use with the combination is, as I said, in always. And in where we can use, as I said, in mostly all types of minor surgery, major surgery, but especially in a cardiac surgery and neurosurgery. Why? Because this drug will not affect on a, as compared to other drug, is not affect too much in a cardiac, and it will not affect on intracranial pressure. That's why it's very first choice of the drug in during the cardiac surgery and the neurosurgery. And the sevoflurane also very good general anesthetic drug for the baby, for the children, for the child. So cardiac surgery and neurosurgery is the first choice of drug, and as usual for the normal minor surgery. So we discussed already all types of inhalational anesthetic drug. Now we'll discuss the intravenous anesthetic drug. Is not too much and not also difficult. So briefly we'll discuss intravenous general anesthesia. First drug, thiopentol sodium. Like that we discuss, because almost the same mechanism. So we discuss fast acting. In a fast acting, we have thiopentol sodium, methohexinate sodium, propofol, and etiomidate. Actually, these all drugs have bad analgesia property, but good anesthetic properties and very weak muscle relaxant. So, good anesthetic properties. Poor analgesic properties and weak relaxation of muscles. So good anesthetic properties, poor analgesic, and weak muscle relaxation. And the main indication is the same, the minor surgery, and in some time also if you using the alone. So in some time during the short procedure you can give, and in some cases like during the narco analysis of the criminals, on the time also mostly like thiopentone sodium will give. Thiopentone sodium, it is ultra short acting thiopentone sodium. So this drug will give on a narco analysis of the criminal on the time, but mostly used like according to the anesthetic properties, according to the general anesthesia, mostly used in the major surgery with combination. Don't forget about combination. Always give with all anesthetic drug with combination. Very rarely will give alone. Very rarely. Now the slow acting, and the last also slow acting. In slow acting we have the three group: benzodiazepine group, which also we'll discuss whenever we discuss the hypnotic anti-epileptic more detail. But now we'll discuss little bit like lorazepam, midazolam, and diazepam, which belong in a benzodiazepine group in short acting. And the next one is the dissociative anesthesia, that is the ketamine. And the next, the last one is the opioid analgesic, that is the fentanyl. So first let's discuss benzodiazepine group. Benzodiazepam. Actually, this is a very popular sedative drug, hypnotic and sedative drug, and it's a good anesthetic properties, but it's a bad analgesic, and the muscle relaxation, even we can say that very moderately it's a muscle relaxation property. So it's also used in during the induction as a any last video we discussed that main stages: induction, maintain, and recover. So by the induction means the first whatever the drug you selecting, the first you giving and produce the potent anesthesia. That is the induction stages. So benzodiazepine also give in by the like by form of the induction stages, like in a first anesthetic. After that, from by the maintenance you can select. It depend upon the patients and depend upon the operation. So by the induction, all inhalational drug like sevoflurane, desflurane, nitric oxide, which are the non-irritating. Remember this thing. Any drug have a non-irritating, and very important the no any smell. No any smell. If any drug, the two property are there. This drug can be give by the induction stage, by the like in a first stage starting. We can start from this drug, which have non-irritating and no any smell. So any drug have the two feature can start by the first starting by the start by this drug, and after that for the maintenance we can select different types of drug. It's depend upon the surgery, it's depend upon the whatever, and for need the further anesthetize the patient. So it's depend upon, and it's of course the for the situation on the during the patients during the surgery. So as I said, benzodiazepine for the best choice of the induction, and it's a also sedative drug. So like any patients have insomnia, the problem in, to the sleep on the time also we can use, and a general anesthetic also can be used. So benzodiazepine we discussed already. Side effects we will discuss after the finish the all drug. Now the ketamine. Ketamine is a dissociative anesthesia, and it's also very widely popular drug for the general anesthesia. Actually, dissociative anesthesia means what? Like any drug have hallucination properties or sedative properties, hypnotic properties. That drug is called dissociate anesthesia. So ketamine has hallucinations. Means whenever you give the ketamine, like most probably 60% or 70% of patients, even 80% of patients have hallucination. Hallucination, we can say it's a like the patients is speaking a lot of things in like during the after the surgery until they will not come in a normal mood. So hallucination means they speak everything, but they don't know what they're speaking until the normal mood. After they came in a normal mood, they don't remember that what they speak during the like when they anesthetize during the anesthesia. So on the time they don't know what. So that is called hallucinations. So that's why ketamine have hallucination. That's the name dissociative anesthesia. So it means it's hallucinations and the anesthetic properties as well as hallucinations. We can say it's a side effects, not it's a main properties. Main properties are anesthetic and good analgesic property. It's a good analgesia. And the muscle selections moderate. And this drug also used in a very short, any short operation, short procedure, but and the combination, as I said already, always with the combination. But one thing also, like during any exam, any questions, if the in a questions are written dissociative anesthesia with side effect or without side effect, just they written the drug have hallucination in a question. Hallucination. And in an option, if you see the ketamine, always the answer should be in a ketamine. Dissociative anesthesia or hallucinations. It's just in a general anesthetic. I'm talking about the general anesthetic drug. And the last one is the opioid, that is the fentanyl. This drug also we discuss during when will they start when discuss the opioid and non-opioid. On the time they discuss a very more detailed, but here this is a little bit fentanyl. It is the opioid analgesic. Opioid analgesic means it acts on the opioid receptor in the brain, and then the patients feel like no any pain. Like opioid analgesic. The name, from the name you can say that's a very good analgesic properties, and the anesthetic property is not good, very weak, and the same weak muscles paralysis. I mean the muscles relaxment. It's a very lipid soluble molecule. That's why it's a very easy to penetrate in the brain, and action becomes the start very fastly. So this drug mainly used for the analgesia, most probably used for the analgesia, and the combination with different types of anesthetic drug. So indication, as I said, that most probably it's used during the surgery, but in some conditions, for example, the patients have epilepsy. Epilepsy means what? Epilepsy means the abnormal electrical the conductivity of the brain. It means brain will too much excited, and as I know from the mechanism that it's act on the inhibitory and excitatory neuron. So it means the glutamate amount of the glutamate is increased too much in the brain. That's why the patients have epilepsy or more excitation. On the time we can also, for the we can say the we don't have any drug of choice, or for the urgent cases we have just anesthetic drug. So for the prevention or for the suppress the like epilepsy for the like for few minutes, on the time we can use the general anesthetic drug. Or in some conditions, for example during the hypertension, the patients have hypertension, on the time also we can use, because it's always I said already that it suppress the cardiac output, so on the time maybe it's useful. And sometime also in a bronchial asthma, like for example halothane it's a one good property that it's relax the bronchial muscles, alveoli muscles. So in a bronchial asthma it's a drug of choice, but it's not main drug of choice, like we can say main indication. It's just like, of course for the bronchial asthma we have special drug we'll discuss in a respiratory disease. On the time we use we'll discuss the which drug is for best for the asthmatic for the asthma. But it's for the in urgent cases you don't have any respiratory drug, but you have to give the patient because in the condition is too much serious, patient can die. On that time, for the save the life, you can use halothane or some other drug, but main indication is the surgery. So now we'll discuss some complication, like before, during the anesthesia and after the anesthesia, post anesthesia. So, or we can side effect during anesthesia and after anesthesia. During the anesthesia, what could be? The respiration become irregular. Respiration irregular. The patients have hypersalivation. Most patients can be see hypersalivation. For prevent the hypersalivation, we discuss which drug, like we can say the premedication or post medication. Due to some drug have very irritate smell, a very bad smell, pungent smell. Due to this, the laryngospasm should be will be can be laryngospasm. In some patients, you can say delirium, like acute confusional phase. Delirium. And the loss of alertness, you can say. Loss of alertness. Cognitive disorder. Cognitive can be interrupt. And sometime vomiting should be, but vomiting mostly in after the anesthesia, post anesthesia. Yeah. Blood pressure, as I said, always blood pressure, like you can say bradycardia, hypotension, arrhythmia can be. So these are the main side effect you can say during this anesthesia, during the anesthesia. But it's also depend on the amount of the drug, way of the drug, depend on the patient, and it's depend upon the also anesthesiologist, because the general anesthesia always give by the anesthesiologist. So it's depend upon the everything, that if patient is not good, or patients have very old conditions, or patients have also like it's a chronic heart disease or some ischemic heart disease, some respiratory problem, some asthmatic problem. On the time, the side effect will be, you can see, more side effect. So it's depend upon everything, concentration of the drug, condition of the drug. After the anesthesia, what could we see? Nausea, always, and vomiting, very common. Nausea, vomiting, and hypersalivation also can be see. Hypersalivation, hallucinations, because if you give the ketamine, you can always see hallucination. And vomiting, hypersalivation, hallucinations. The BP fluctuation should be sometime. BP fluctuations can be seen. Maybe sometime like respirations become irregular, but in a very rare. There is dependent on the drug amount. It's dependent on metabolized. If the more soluble drug, so it means what? If drug is more lipid soluble and more solubility, not insoluble, not too much insoluble. It's more soluble and lipid. So it's all accumulated in a adipose tissue, in a fat tissue. So for the metabolizing, it maybe take more time, like 10 hours, even 1 day, even 2 days. So that's why the effect will be decrease very slowly, because it's too much accumulate due to the lipophilicity and too much soluble in the blood. So these are the main our side effects and complication. You can see some pre-medication drug and post-medication drug we should know. First we discuss the pre-medication. Pre-medication means before the operations, because some of patients may be too much scared, too much fear that they are going to operation, they are going to surgery. So in some patients have before the operation hypersalivation. So in this case, the pre-medication we should give atropine, that is the anticholinergic drug. We'll discuss whenever they discuss the anticholinergic drug. Atropine or hyoscine, but mostly atropine. The two drugs which give for the hypersalivation, it prevents the hypersalivation before the operations. Sedative drug, like is too much fear, too much scared. So on the time we should give benzodiazepine group drug, like diazepam or lorazepam, alprazolam, midazolam. So this drug to help like anti-anxiolytic, or we can say the tranquilizing drug. In some time, like for the but like the operation will be for the 2 hour, 3 hour, 6 hour. On the time is go and S2 antagonist or proton pump inhibitor for the prevent the too, like if too much will be HCl produced in the stomach, it can be damage the our intestinal mucosa, stomach mucosa. So H2 blocker or proton pump inhibitor, proton pump inhibitor, like ranitidine H2 blocker, omeprazole, rabiprazole, and lansoprazole, cimetidine, lot of like all titine. Remember like that. We'll discuss already. We'll discuss this drug in whenever they discuss anti-emetic and all that. So H2 blocker is all types of titine that is belong to the H2 blocker, and all types of zole like omeprazole, lansoprazole, pantoprazole, that all types of zole is belong to proton pump inhibitor. So these are the pre-medication before the operation for the prevent this types of symptom, this types of problem of patient. And now we'll discuss the post-medication, like after the whatever complication or whatever problem will there after the surgery or after the post anesthetic, like vomiting. So for the prevent the vomiting, we should give anti-emetic drug. Anti-emetic drug that is most widely drug and most popular drug, metoclopramide. That is a best anti-emetic drug. This drug is the inhibit the vomiting center in the medulla oblongata, and then vomiting become inhibit or vomiting become stop. So anti-emetic drug can give, or also can give like H2 blocker and proton pump inhibitor for the prevent the HCl secretion. So these are the main post medication drug mostly, because after the post medication, after the like post anesthetic, vomiting and nausea, the two are the most probably will be there. So these are the main main concept like which are already discussed. Some contraindication. Like if patients have chronic cardiac disease, for example, in a severe chronic cardiac disease, or atherosclerosis, like third degree of like 90% the block the atherosclerosis, or in sometimes COPD, chronic obstructive pulmonary disease. But some of the drugs are useful, like Halothane useful for the COPD or bronchial asthma, and also like Isoflurane. Isoflurane also will not act in a heart. So like if patients have pheochromocytoma, that is the tumor in adrenal medulla, on the time too much norepinephrine and epinephrine will be secreted due to the tumor. But on the time if you're using the Isoflurane, they will not any harmful in the heart. So we can say it's depend upon the drug and patient situation, that in what condition which drug you giving, and on the time patients have what's problem. So it's depend upon the time. But usually from like during the hypotension, acute hypotension or severe hypotension, we should always will not use during the hypotension on those cases, on those time or on those cases who have hypotension. And also is, as I said, that is depend upon the situation. So contraindication not like any specify that in this condition you will not use this anesthetic drug. So I hope you will be understand and you will like our discussion. And our next topic will be the adrenergic agonist. Very soon we'll discuss about this topic, adrenergic agonist, then we'll discuss antagonist. So thank you so much. Hope you will understand the general anesthesia, and after that we'll discuss the adrenergic agonist.